Child Psychiatry Last-Minute Flashcards. A 2-year-old girl frequently postures her lower extremities and keeps crossing her legs in repetitive movements. She stops when her mother is distracting her. The mother is concerned about her having a seizure. Self-stimulatory behaviors. Seizure will not stop with distraction. Very important to know. Best management guide the child to limit the behavior, otherwise it is a normal behavior. Two siblings are jealous of each other and are always fighting each other in front of their parents. Sibling rivalry. What is the best approach? Focus on individual needs of each child, giving each the time and attention needed to feel loved and secured. During the fight, they should be separated and told violence is not allowed. A child with speech and language delay. What is the next best step? Formal audiology evaluation. Even if parents believe that the child hears very well, very important to be familiar with risks of language delay. Any cause of global developmental delay, male sex, boys affected more than girls, family history of speech and language disorders, moderate to severe hearing loss, and lack of environmental stimulation. An adolescent with 2 weeks of depressed, irritable mood, decreased pleasure, lack of interest in activities, and suicidal thoughts. What is the best initial treatment? This is a case of moderate to severe depression, and the best recommendation here is to start the treatment with cognitive behavioral therapy and medication at the same time. SSRI medications are the best, and FDA approved SSRI medications for treatment of depression adolescents, fluoxetine and escitalopram. What is the first line treatment of ADHD in children 6 years and older? Stimulant medications, for example, methylphenidate. This is the most effective. A 6-year-old boy with significant receptive and expressive language problems, he's in special education classes, has difficulty with changes and sensory sensitivity. On physical examination, he has large ears and strabismus, normal-sized testicles. He bites his hands frequently and avoids eye contact. What is the most likely underlying condition? Fragile X syndrome. The key words: intellectual disability and autistic-like features, plus having large ears and strabismus. Very important to know that these signs may be subtle. Very important also to know that the size of testicles in Fragile X syndrome usually post-pubertal, not in pre-pubertal kids. The most common cause of inherited intellectual disability is Fragile X syndrome, and the best test to confirm the diagnosis is Fragile X DNA analysis. Visit lastminutepediatric.com to learn more about last-minute flashcard videos. You are able to review these cases in the Last Minute Review Chapter 33 in the 3rd edition. Thank you and good luck in your exam.